Today's conversation: overcoming the burden of disease.
Thank you so much, Pro Vice Chancellor Dr. Luz, Bishop Tedroy, distinguished guests and colleagues. It is such an honor to be with you here this afternoon, and indeed an honor to have followed Professor Sir Hilary Beckles and to be so fundamentally moved by his truth, to be so fundamentally reminded about how we became to be where we are, and why any understanding of our experiences today or contemporary experiences must be firmly rooted into the realities of our day-to-day experiences, but a true acknowledgement of the historical journeys which we individually and collectively continue to take as people of the diaspora. So this evening, I've been asked to do a little bit of reflection on my experience of leading a city of 9 million people through a global pandemic, to reflect on what I've learned about inequalities as they manifest themselves through COVID. And finally, to perhaps share some of the innovation, some of the new ways of thinking, some of the new ways of working that we're now putting in place, so that we both learn from this pandemic, but we commit individually across communities and across political parties and nationally to build back better and fairer than where we were. So a little bit about myself. As you heard, I am a public health doctor and an infectious disease epidemiologist. And over many years, I've specialized in the understanding the patterns of how disease spread and how an understanding both through research as well as through implementation of programs, you can help to inform government policy and help to improve the lives of millions. COVID was not the first pandemic that I have worked on. In fact, I began my medical career in the early 1990s working on the HIV pandemic, a pandemic which has gone on to affect millions around the world, with millions having died from the disease. Yet today, we look with hope. We look with promise, and certainly in the United Kingdom, our hope is that we will eliminate HIV transmission by 2030. And I begin with this story because as we go through this pandemic, when the end is not necessarily in sight, when we hear stories about what's happening in India and your own experiences in the Caribbean, and what is happening across the world with global inequalities, with a disproportionate burden of disease, especially in the most marginalized and disadvantaged, we see echoes of previous pandemics. Echoes of flu at the beginning of the previous century, echoes of TB and hepatitis and other infectious diseases. And the story of COVID is yet to be told. So in the short time I have available this evening, I want to do three things. To do a little bit of reflection as a leader about what I've learned from the COVID pandemic, and then just to highlight some of our few lessons learned from COVID and its impact on inequalities. And then finally, I'll end with what I think are three of the key defining lessons and principles which I'm taking forward and which we are taking forward across our city in London to fundamentally change our future. So I would not wish this on anyone to be in the middle of a pandemic, but being in the middle of it and having to lead through it has been a privilege of my career. You know, many of us enter public health because we realize that true health is not simply a matter of getting access to high quality care, but it is about how we take care of those we love, the people who we surround ourselves with, our housing, our jobs, the way we're supported by our communities and family and society, and our ability to be resilient so that when faced by threats and shocks, we're able to pick ourselves up and to move forward. This pandemic has left three indelible lessons in my mind and in my heart when it comes to leading through a pandemic. First, recognizing that this disease, as with many other diseases and conditions, never ever randomly affect different members of the community. But very quickly, diseases such as COVID find a way to manifest themselves in those who either are the most socially and economically disadvantaged, those who have poor access to health and care services, those whose behaviors or lifestyles or ways in which they're interacting with society place them at high risk of acquiring infection. And understanding the realities of inequalities and how infectious diseases both amplify as well as illustrate those inequalities has been a hallmark of this pandemic, whether here in the United Kingdom, in many countries around the world. Who's affected by the disease, their ability to practice prevention measures, and whose ability to have the economic and social wherewithal to protect themselves has been a fundamental marker of disparities in this infection. The second leadership lesson that I've taken away over the past 18 months is the importance of grounding your work and grounding your policies in evidence, but recognizing that that evidence may well be evolving over time and moving very quickly. And the certainty that we all want. How is COVID transmitted? What should I do to protect myself? Is this vaccine effective? Does testing work to help to reduce the risk of transmission? These are questions that we have been answering and exploring and learning from over the course of the pandemic, and rooting our responses, whether you're in Jamaica or Barbados, in the US, or certainly in the United Kingdom, finding that space for understanding science and evidence and how it influences policy in ways that are effective and that can save lives quickly has been a second hallmark of learning and leadership learning for me in this pandemic. The third lesson for leadership has been the fact that we cannot and will not ever and never have solved any pandemic, solved any infectious disease by focusing only on national to local, top-down policies, programs, strategies, or actions to control an infectious disease. In fact, here in the United Kingdom, a key pivot for us in terms of truly developing a community-centered approach to tackling COVID came from the realization that truly culturally competent, effective approaches to tackling this pandemic must start from and with communities, must start with a commitment to building cultural competence, must start with an ability to think through your pathways for implementation, for scale and impact. And that can only come by starting first local and moving up. Starting first from the lived experiences of the people we're wanting to serve, and starting first by ensuring that we truly engage with our communities, with our local experts and practitioners to understand what truly matters. Now, there have been many other leadership lessons that I've learned along the way. And I think a key part of what I think has driven much of this learning is what has unfolded over the past year, which has been the disproportionate impact of COVID on Black, Asian and minority ethnic communities here in the UK. And we've seen very similar patterns in Western Europe, in the United States, and patterns of disparities which have manifested themselves as COVID has spread across the world. In the UK, in the first wave of the pandemic, we knew that people from Black ethnic backgrounds, Black Africans, Black Caribbeans living here in the UK had a much higher risk of being diagnosed with COVID, and once they were diagnosed with COVID, to progress to severe disease and death. In the second wave of the pandemic, which we experienced over the Christmas and New Year period, we saw a similar disproportionate burden among Asian communities, with individuals of Pakistani and Bangladeshi backgrounds bearing the brunt of infections and death from this disease. But this risk was not mediated because of the color of our skin, but work that we've done over the past 18 months with local partners have highlighted a range of factors which place communities at risk. From fears around getting tested and presenting to healthcare services late, from the importance of other long-term conditions, diabetes, uncontrolled high blood pressure, chronic lung disease being risk factors for severe disease, obesity being another risk factor with highly prevalent within our communities, which meant that for individuals who may have been exposed to the virus, they are much likely to have a more severe clinical course. We learned much over the last year about the social and structural factors which drive transmission risk and the probability of being exposed to the infection. So, for example, we know that a significant proportion of people who occupy the most key worker occupations that have been affected by COVID were from Black, Asian, and minority backgrounds. So if you're working in the service industry, in transportation, public transportation as bus drivers, in the care industry, such as social work, as well as in hospitals, we know that many of these positions within our societies are borne by those of Black, Asian, and minority ethnic communities, thereby increasing their probability to be exposed to COVID and, again, to develop severe disease. Now, learning about these risk factors has been essential in helping to guide policies to intervene. And with each successive wave, we've been able to nationally ensure that we're now engaging with communities differently, providing more culturally competent materials to inform, educate, and empower. Ensuring that our campaigns are now available in multiple languages, showing images of people who are not necessarily white and middle class, but images in languages and contexts which speak to us and speak to us authentically. We now have programs which are being delivered in partnership with faith institutions, community-based organizations that speak to the needs of communities, whether for testing, for contact tracing, and more recently for the vaccination against COVID. And we're working hand in hand with communities to find solutions to difficult problems, such as vaccine hesitancy, myths and misinformation about the safety and effectiveness of vaccines, and what communities need to do in partnership with leaders within health systems to help to address these wicked issues. So we've learned much over the past 18 months, and certainly as a leader, I have evolved, and as a key part of our leadership evolution over the last year is being honest about COVID's impact and being honest about the factors which place communities such as ours at increased risk, and being honest about linking conversations from Black Lives Matter movement to George Floyd's death, to the inequalities that we observe, to systemic and structural racism and how it fundamentally affects our experiences, our access to services, and our outcomes in health and other sectors of life. So, in closing, I briefly wanted to share with you the journey of one man, a public health director of our city, our capital city here in England, and the experiences that we've had and the lessons that we've learned. In closing, I think there are three key takeaways that are shaping not only my practice as a public health physician, but also as a leader working within the system here in the UK and certainly in London. First, the importance that on recognizing that any progress that we will make from this point forward must come from working differently to achieve different outcomes. And the pandemic has shown us the critical importance of breaking down barriers horizontally, working with new partners within place, leveraging assets to problem solve and to do things in a far more agile way, far more systemically, and doing that at scale in order to have impact. The depths and strengths of the partnerships that we've built over the past 18 months as we've gone through the pandemic, I think, now sets us with a new foundation for achieving even greater things as we emerge from this pandemic. Second, over the past year, we've learned so much, we've done so much, and we've developed so much technologically in understanding how we engage and work with communities and how we deliver programs at scale effectively. And the second key lesson that I hope will shape the way we do things differently moving forward is the ways in which we're now engaging with communities, the conversations that we're now having, from everything from mental health and COVID to the vaccine hesitancy, to really beginning to think through structural factors which have been affecting us as communities, and having authentic conversations with physicians and politicians and faith leaders and community organizations working together to solve problems differently. That must be one of the legacies of this pandemic, and it's a legacy that I'm committed to supporting. Finally, in all of the sort of things that I will be taking forward with me, is ensuring that the work of our health and care leaders, of our volunteers, of those working at the grassroots level, which are fundamental to the success, not only of our COVID response, but of everything we will now attempt to do to rectify the decades of insult and trauma that our communities have had to deal with, that manifests itself today in enduring inequalities, that we join hand in hand with our communities to ensure that they too, that we too, together, remain part of that solution. So colleagues, thank you so much for the invitation to speak this evening. Unfortunately, I am moving on to another national briefing and seminar now, and I will have to leave you for the evening, but it has been such a privilege to participate, and I look forward to seeing the results of this symposium. Thank you.